What is National Core Indicators? National Core Indicators is a national initiative that uses surveys to hear directly from people getting long-term services and supports. These surveys provide insights on improving those services. Across the United States, millions of people with intellectual and developmental disabilities, IDD, older adults, people 65 and older, and people with physical disabilities get long-term services and supports through Medicaid. Long-term services and supports, or LTSS, are supports people receive to help them in their everyday lives. These supports can include things like help getting dressed, making meals, support to access the community, and many other services. NCI includes two programs that hear directly from people receiving LTSS about how their lives are going and whether the supports they receive help them live the lives they want. National Core Indicators Intellectual and Developmental Disabilities, NCI-IDD, launched in 1997 to hear directly from people with IDD. National Core Indicators Aging and Disabilities, NCI-AD, launched in 2015 to hear from older adults and people with physical disabilities. NCI asks questions about people's lives, things like whether people are able to see friends and family, can spend time in their communities, make the choices they want, and get the health care they need. The information and outcomes collected from NCI are compiled into state and national reports that help states develop initiatives, set policies, and benchmark and track their progress over time. States use the data to compare groups like regions in the state to see how people are doing and identify how services can be doing better. The data are also used in stakeholder meetings and advisory councils to get feedback from the public and help guide state priorities. NCI information is also used by researchers and others in the field to look more closely at specific topics. The data collected by NCI is ultimately used to help improve the lives of people with IDD, older adults, and people with physical disabilities.